From next step, we shall be informed.
First of all, we really want to thank His Excellency the President, who has given us this opportunity to serve. He must have selected us using his own system, and we really appreciate and thank him. We commit that we shall not let the sector down. We shall do everything possible to strengthen the human resource in this country, in the health sector. Thank you. Of course, we have just been meeting the Parliament today. As you know, the President appoints, but Parliament must approve. So we were meeting Parliament today, and we hope and pray that they approve us, the whole team. But if approved, first of all, we want to thank the Commission which has been there. They have done a great job, and we are going to build on the experience of the great work that they did. We are not going to reinvent the wheel. They did a great job already. They have some achievements. There are areas they left incomplete, and we are going to carry on from there. In addition, we shall also do a SWOT analysis. We shall try to see what are the strengths of the system, where are the weaknesses, what has been achieved, what are the opportunities, and how can we build on what they already started, and how can we make it even better. You know, of course, you come in with a lot of strengths, you come in with a lot of ambitions, but we want to use our new energies and our experiences to see how we push the health sector forward. Many of our members have different experiences. Some have been hospital directors, others have been in the labs, others are pharmacists, others human resource managers. So all of them have different qualities that they are bringing with them. And we want to build on those qualities and make a stronger commission and do great work for our health workers.
I think as the Director General,
one of the strongest areas really I would want to work on is to work with the Ministry of Health. There are health workers who have been in place, recruited. We want to see how do we support them to deliver maximum outputs out of them. Because much as we are looking and recruiting new health workers, we would want the current health workers that we have to deliver to their maximum capacity. We do not want situations where somebody is in position and yet you are appearing once or twice in a week, and yet there are so many people on the street there who want to come in and deliver that service. So working with the Ministry of Health, working with the Ministry of Local Government, working with the Ministry of Public Service, I would want us to make sure that we have over 50,400 staff, public servants, those recruited by government. They can deliver a good service if all of us deliver to our expectations. So the drive should not be recruit, recruit, recruit. The drive should be let's make best use of what we have, then we look for the gaps and we see how many more we need to recruit. Because as you know, the budget is also limited. The recruiting will come, but in phases as we go along. So my first priority is to make the best use of the health workers that we have. Then we can look at areas like where specialized areas where we need specialists. We look at rural areas where we need the staff, where the staffing norms are low. We look at areas where you require more specialists and prioritize those. Then you also look at promoting those who have been in the field but have stagnated. We have people who have got additional qualifications, but they are still employed at the old position. When somebody is a nursing office, he has even a degree, but is still being employed as an enrolled nurse. So those are the people we need to push up, promote them, but make sure also that they deliver.
Maybe you can help me on how to.
That is a very important question, because as I have emphasized, the existing staff need to deliver. So how are we going to make them deliver? One is supervision. we need to strengthen supervision of our staff, right from national referral hospitals, regional referral hospitals, general hospitals, and lower level health centers. At the lower level, we are looking at the local governments, the CAO, RDC, the chairperson, supervise those staff so that they deliver results. His Excellency the President increased our salaries. So the issue is not poor wage, it's not poor pay. The pay has been solved, but what have we done? Then the other aspect which will help us to address that issue, we need to start a system where you check, you document Mwebesa. You have been a doctor in Serere Health Center. In the last 3 months, what are your outputs? What did you do? It's not a question that Mwebesa came and sat and I'm a staff at Serere Center. What did you do exactly? I did so many scissors, I did so many operations, I saw so many patients, I did so many investigations. That one we need it now documented. That's the only way we shall confirm outputs of people. What did you exactly do? Did you come and read newspapers in our facility? Did you come and check in the morning, sign, went to your clinic across the street, and then you come back in the evening, sign out at 5? Of course, if I'm going to assess that, it will show Mwebesa came on Monday, he signed in at 8, he came back at 5, signed out. It will show he attended, but what did he do? That is now the area we are going to. You must show me for the last 1 month, I did this, I did this, I did this. If that is okay, then I should be paid. And I think that's why we should even be going to determine who should be paid. It's not just by attending, but what did you produce when you attended? And then you can determine whether to pay me or not. With her, I agree with her. But not to everybody, not to everybody. There are people who are working. We should also appreciate the people who are working. You know, when you go to all these hospitals, you find cesarean sections being done, mothers being delivered. We deliver 1.8 mothers every year, and 90% of those are delivered, 80% are delivered in health facilities. We admit so many mothers. We do preventive service. So people are doing good services. But also it is true that there are people who have not shown good outputs for the increased pay. And those are the people we want to go for now. But the people who are doing a good job, we thank them and we appreciate them. But there are really those who have not changed at all. Despite the increase, it is really 300. Because if a doctor came from 1.8 to 5.4, that's 300%. So we need that doctor to show results for that pay. The nurse has moved from around 1 point something to 2.8. That's good money. Yeah. The total number of health workers we have in this country, 50,400 employed by government. But that is about 40% of our staffing norms. That is the new staffing structure. When you look at the old staffing structure, which has been in place for the last 15 years, we are at around 80%, but that's the old structure which we designed around 2001. So the question of understaffing is still there. And but of course, this is budget limitations. If there was money, we would want the whole structure to be filled, but that money is not there. And we are not the only sector. There is agriculture, there is education, there is all other sectors. So we cannot also be selfish and say that we want our sector to be filled. But my emphasis is, let's first emphasize outputs from the few that we have. The few that we have. Then we analyze where we have big gaps and we prioritize that. Like specialists, like the rural areas where you find they have only 1 nurse, 2 nurses, 2 midwives running the whole area. Then we can go for those focused weak areas. As I said, we have to do a situation analysis and then address that.
And finally, talk about corruption.
When that talk of corruption, especially at the districts, I've heard of that story at the district service commissions. A nurse to get a job has to pay well I've heard it as an allegation. I don't know if it is true or not, but I would really emphasize that it is very bad, it is very illegal, and it is unacceptable. You can imagine I'm a parent. I've just educated my daughter. She's now a nurse. I've been struggling to get fees, and now I'm happy, I'm excited. I've just got that nurse out, and now I want her to get a job. And then you come to me again, Mwebesa, can you, Daddy, help me with 7 million? The commission wants 7 million in order to recruit me. But I thought I'm done with educating you. Now I have to pay even 7 million to get a job. I think that is very abnormal, and it's very unacceptable. And for me, in our commission, if such a thing happens, then that is totally unacceptable, and we'll do everything possible to fight that thing, because there is no reason why you should do that. Commission members are paid very well. I must say, honestly, they are paid very well. There's no reason for them to go corrupt, looking for money. Many of them are very senior people who have been working. Some of us are at retirement age. You cannot start going looking for 2 million, 3 million from a candidate coming to look for a job. That will be a disgrace. So that issue is unacceptable, and I don't think we shall have problems with that in our commission. Yeah.
Asajja baludde minisitule